Sometime between June and September of this year, a letter is going to land in your mailbox.
And if you're on Medicaid, disabled or not, that letter could decide whether you still have health coverage on New Year's Day 2027. I'm going to walk you through exactly what it says, who's exempt, who isn't, and the one paperwork mistake that's already cost people their coverage in the states that started early.
This all traces back to a federal law signed in July of 2025 called the One Big Beautiful Bill Act.
Buried inside it is Section 711119, a section that quietly rewrote the rules for Medicaid. Starting January 1st, 2027, most adults between 19 and 64 who get Medicaid through the expansion population have to prove they're working, volunteering, in school, or in job training at least 80 hours a month, every 6 months, forever, or they lose coverage.
Before anyone panics, here's who the law says is exempt: people 65 and older, people entitled to Medicare, people receiving SSI,
People with disabilities, pregnant and postpartum women, caregivers of kids under 13 or caregivers of disabled family members, former foster youth up to age 26.
If you're on SSDI long enough to have Medicare, you're categorically excluded. That part is written into the statute.
Here's the problem. The law uses what advocates call the narrow SSI-based definition of disability. Nationwide, nearly 2/3 of Medicaid enrollees who report a disability don't qualify through that stripped SSI pathway.
That means people who are clearly disabled, chronic illness, mobility limits, mental health conditions, could still get caught up in the paperwork system and have to prove their exemption every time renewal comes around.
Being disabled isn't enough. You have to be disabled in the way the form recognizes.
2 states didn't wait for 2027. Georgia has been running work requirements since 2023. Nebraska launched its version on May 1st of this year, just 3 weeks ago.
And the early data tells the story. In the states that ran work requirements in the past, eligible people lost coverage.
Not because they weren't working, not because they didn't qualify, but because the paperwork was confusing, the notices were unclear, and the verification systems made mistakes the enrollees got blamed for. If anything in this video has been useful so far, do me one quick favor: hit subscribe. This channel is me sharing what I'm learning about disability life from inside it.
And these policy videos take real research to get right. Subscribing tells YouTube to show this to other people who actually need it. All right, back to the part nobody told you about.
Federal rules require state Medicaid agencies to start contacting enrollees between June 30th and August 31st of 2026 by mail and by at least one other method: phone, text, email, whatever the state picks. That notice has to explain the work requirement, list the exemptions, and tell you how to report your hours or claim your exemption. If you move, if your address is outdated, if your phone number changed, and the state can't reach you, you can lose coverage for paperwork reasons alone. For people who aren't exempt, and this matters because some of you watching might have a family member in this group, the requirement is 80 hours a month of qualifying activities. Work counts, volunteer hours count, half-time enrollment in school counts, job training programs count. You can mix and match, but you have to report it.
And the state has to verify it, every 6 months at minimum. Some states will require more often than that.
There are short-term hardship exemptions the states can use: people in hospitals or nursing facilities, people in federally declared disaster areas,
People living in counties where unemployment is over 8%, or 1.5 times the national rate. People traveling for medical care outside their home for extended periods.
These aren't automatic. They're case by case, and the state has to approve them, which means more paperwork, more processing time, more chances for something to go wrong.
Researchers and state Medicaid offices are already saying the same thing. The systems won't be ready by January 2027. State eligibility workers haven't been trained on the new rules yet. The notices are being written under deadline pressure. Call centers are going to be overwhelmed. And the people most likely to lose coverage aren't the people the law was aimed at. They're the people with chronic conditions and fluctuating health, caregivers, and folks who don't have reliable internet or transportation to get to a Medicaid office to fix a flagged file. Here's what to do today. Not in 2027, not when the letter comes, today. 1. Make sure your address and phone number are current with your state Medicaid agency.
That fixes about half the problems before they start. 2. Pull together your documents, diagnosis paperwork, your SSI or SSDI benefit letter, proof of school or training enrollment if that applies. Put it in one folder. 3. If you have a case manager or work with a disability advocacy group, tell them you want to flag your file for exemption review before the outreach window opens. Don't wait for the state to figure it out.
The hardest part of all of this isn't the rules. It's the fact that the people who designed the system don't have to live inside it.
So here's what I want to know in the comments. Has your state contacted you yet? Are you on Medicaid? Or do you know someone who is?
Because the more we share what's actually happening in real mailboxes and real Medicaid offices, the harder it gets for any of us to fall through the cracks alone. Drop it below. I read everyone.